Today's class we will see about the quantitative research and steps. What is research? Research is to see what everybody else has seen and to think what nobody else has thought. That is a research. Everyone thinking that research means something very big thing. You do not know in the world even one chocolate, even I take Alphenlibe or Eclairs, or you can take one hairpin, or you can take some Tupperware tiffin box. Everybody silently doing a research. We think that only clinical trials we are doing and there are drugs only going for the research. No, everywhere, every field they are doing the research. Why do they do research? Research to improve the quality, to improve their business, to go with the technology, and to improve the quality and accessibility easily available. Many reasons are there to do research. So research in the sense it is like a orderly process. It is an orderly process. It is really dealing with the problem and variables, and it is stated in a numerical form as a research. It also the research means it starts with the identification of the problem and formulation of the research problem, or and ends with the dissemination of the research findings. Okay, what is the problem? For example, I tell you something. When I was there in 1997, 6 in the range, I was working in a primary healthcare center. Government was telling all the centers to implement the IUDs. Continuously we were posted there in our internship. I could see so many women come to remove IUD and some are inserting IUD they are coming. When I see the removal coming for the IUD, many of the women became very thin. All their breast became and all their body became very thin, and some one or two or few women become overweight. So you know that first generation IUD, second generation IUD, various research they have done and they improved the standard. First generation was lipase loop, second generation were copper T, and third generation were levonorgestrone, the hormone they were using, right? So what's happening? This one. So there is one question came in my mind. Is there IUD insertion in the hormone? Is causing the bodily changes, or their sexual organs are getting changes, or the weight loss? This is a question, it's coming in my mind. So this is a question I have to try to formulate the problem. I have to answer what is the research. It is a systematic manner and disciplined method to answer the question. How I can answer yes? I cannot say yes or no. I have to go through many primary health care center who were undergoing before insertion of IUD. What is their figure and what is their data of the weight and everything, and how long they were, 3 years, how much the weight reduced. So many things I have to test it. I have to frame the hypothesis. What is that copper T is increasing the weight, or is the copper T is reducing the weight? This my doubt question has come into my mind. So we make it as a problem statement, and the problem has been in a step-by-step phase. It is analysis. That's called the research. Okay, let us see major steps on a quantitative research. This qualitative is evolving emerging design, that we will see in some other class. The major steps is first phase. They are dividing into 5 phases. The first phase is a conceptual phase. The baby is conceived in the mother's womb, right or not? Then there is a designing on planning phase. Everything, head, heart, fingers, all are just coming. Then empirical phase, you could see the growth very nicely. And then analytical phase, and will be the dissemination base. So this is how the result. Analytical phase, nicely the baby born and we are disseminating. Like that, it's a research is a kind of a baby. We are growing, how we have carefully will analyze the baby. That is called mainly research. Let us see. First phase is a conceptual phase. Conceptual phase, first is a formulate and delineate the problem. My problem is that copper T is causing, this is the problem. So I have to, any problem I have to make it, I have to think about the 4 dimensions. What is the dimension? Substantive dimensions. Whether it is clinically, theoretically will be testable or not. Is it methodologically I can analyze it? Is it practical applicability is there? Is it ethically correct what I am doing? Yes. So I have to do this. Then I have to do the review of literature. Of course, review of literature will be going on the time you start the research until you disseminate the knowledge, or it will be continuously going on. So what is called review of literature? So the review of literature is it's like a known topic or further investigation you will do. How do you do? How where you will get the further investigations? When we were doing a research 1997, we have to go to the libraries and going and back volume. We have to search. Now the Google is present. So many Sinhal, many platforms. Somebody apps also will be available to review the literature. So journals, newspapers, reports, magazines, electrical devices, like why we have to do, what is the, everything available, but you need, every vegetables are available, you need to skill in cooking, right? So you have to know the skill in developing needed research. You have to take, you must have a skill. So what you have to do, you have to find out the keyword correctly, you have to search the many literature. Understand? So they develop the, then will be the developing the, after review of the literature, develop the conceptual framework. Conceptual framework or the theoretical framework is a framework help to develop the hypothesis, and it is also telling what is the relationship between your problems, your objectives, and it view correctly about your phenomenon of research, it will be viewing. That is why you have to select the correct conceptual framework. This will be telling the whole totality of your study. It will be telling in a one form, bird's eye view, we are telling graphs and like that. It's a easily one view you can get. Then will be formulate the hypothesis. So hypothesis is a assumed statement, isn't it or not? Property may reduce the weight or property may, it's like a clearly not, you have to write it in a clearly understandable manner. So this is the first phase. The second phase will be the designing and planning phase. What is called designing phase? It's a selecting the research design. The design will be, it is a systematic plan, it spell out the help to answer the question how, when, where, why, what is ethical. All these questions are going to answer by the research design. It is the blueprint of the research is the research design. What all the designs are there? Descriptive design, experimental design, Solomon 4 group design, factorial design, like that many designs are there. You have to think what design you are taking, but while thinking and taking, what, whom, is it ethically okay, my research is bringing some benefit to the individual or harm to the individual. Harm to the individual, you have to you have to stop immediately, correct or not? For example, syphilis, how this, they want to study about the natural history of syphilis, how it is coming. So they have introduced some of the jail people putting the vaccine and not given any treatment. They were seeing the dying process, how they are dying. It's really ethically wrong. We are not supposed to do. Okay, next is developing the protocol for interventions, right or not? So you have to develop the protocols for the intervention. What is the protocols you will be developing for what all the this, what you are going to give for the interventions, how much amount or this one, or only questionnaire method, what is the tool you are preparing. So it's according to your study. It's a constructive, what is the, with the skill you will develop it. Identify the population to be studied. Which is the population? For example, I have taken anemia. Anemia is many of the studies telling that adolescent anemia is only root cause for the IMR and MMR. So I was highly motivated to take anemia. So what we can do in a diet wise and with is economically cheap and easily available, easily acceptable to people. So I selected gooseberry, amla. It's nearly available, very easily available, very cheap. They can easily homemade also. So it was so much interesting. So I have identified adolescent population was suitable. How I identify? I review literature from the newspaper I'm seeing. When I'm studying all these things, I got an idea. Then design the sample plan. How much is my sample size? What is my sample plan? So one study I can do. If it is descriptive study, any descriptive study, you study it, and then what is the size of the sample? What is the how the sampling you are going to sampling plan also? How are you going to probability sampling technique or non-probability sampling technique or snowball and all will be coming for that non will be coming for qualitative study. Leave it. But other thing, how are you going to quantify them? Right or not? What is called sample? Sample is like, this is the total population, a proportion of the small amount of population you are going to take. This population only you are going to test for hypothesis. This will reflect the total population. It is called the sample, right or not? Then will be ethical establish the ethical consideration. What are all the ethic, fidelity, informed consent, non-beneficence, like the many 7 ethical principles you follow. Then you go for the pilot study. Pilot study is called the feasibility study. Pilot study will tell the cost. Pilot study will tell there is a tool is wrong. Where is the feasibility? How much is needed? Do you need any numerator or anyone to be trained? Whether you could be able to do the main study? What are all the disabilities? Are the little change you can consult with, when pilot study presentation, you can consult with your propose itself, they will help you all these things. Then pilot study, you can tell the teacher what are all the feasibilities, what are all the possibilities, what are all the good thing you have faced in the pilot study. For example, I tell you, when one of my student, PhD student, was doing like hemodialysis, like that he was doing. In that, he developed the tool diabetes, hypertension, something else on 4 choice he has. And most of the patients told they have both. There is no option was given. In the pilot study, we found out that so most of the patients were asking him, "Sir, I have both. What will I do?" So what I'm A and B is there. So you can write it in a fourth one. A and B also cost for the this one. So these are the everything you can check. What is the finance? What is the distance? Whether they understand your language or you have to change the language. Everything will be. It is a feasibility study, or it is called the rehearsal study. What you are going to do, that is called the rehearsal study. So it is actually it will be helpful for your main study if you are doing a really pilot study in a correct manner. Understand? Next is a empirical phase. Empirical phase is a real phase, real drama, the core heart of the study. You are going to collect the data. The data collection should be non-biased. Okay, understand. The data collection method may be vitro, non-vitro, or the equipment you are selecting for data collection, correct BP apparatus. You check the feasibility and check whether the machine is working 1 or 2 times. What is the reliability and validity of the tool? Everything before you have to check it. After that, then only you have to implement the tool. Understand? Then will be the preparing for the data analysis. What is called data analysis? So it's a descriptive statistics and will be inferential statistics. Descriptive statistics, mean, medium, standard deviation, mode, other thing. And a pair test, F test, many things, ANOVA. So all these things will be testing for the hypothesis. It will be telling whether your hypothesis is correct or it is been rejected. What to hypothesis? So this is the answer for your question, whether this is the causing, apparatus causing weight loss. There's a question came, but I never done that study. It is too long. In my stipulated period, we cannot do that. Anemia is better. Most of the feasibility, many population I will get it. Sample size is easy. So I can think many things, but doing practically conducting research is very difficult. Many questions come to your mind, but you have to think whether it is methodologically it is okay, practically possible, ethically they will accept it or not. What are all the variables will be confounding variables? Some of the variables, how are you controlling? They will be asking examiner. You took this study. No, maybe matter of this. They may be another some diet or something they have followed. That is why they reduce. How you are telling how you control those variables? Many questions. So all these things you have to, the dimensions you have to think when you are selecting the problem. That's why when in my small age I thought about the problem, I not implement in my PhD study. That is the reason. So simply that teacher is telling, this teacher is telling, she is forcing, somehow I have to get the degree. 99% of the students, they want to get a degree, either the PhD or BSc or MSc. Anybody is forcing their idea, any teacher is telling, okay, they will get it. That is not the way you will get the knowledge. You have to stand in this one. What is your interest? That's very important. That's my advice. I'm just telling you. Then analytical phase, analyze the data and interpret the results. And most important, not a least important, last but not a least important, it is a main important one is a communicating. Communicate the findings. I always, whenever I talk an example, I will tell them. In my study, the people are taking even a iron syrup for the adolescent girls. 1.5 gram. For me, it's a natural diet. Even 20 days, I given 1.5 gram has increased. And what is the disadvantage in anemia? When they are making the iron syrup, so many chemicals and their teeth are turned into the color. So many issues was there. And the next is called the utilization of the research finding. It's very, very important. So once you communicate, how will you communicate the findings? We will be communicating the research. When you are taking class, you can tell them, and you can journal, you can publish in the journal. In the conference, you can present your findings. Understand? In next journal, you can post it, and utilization of the finding for the practice. So one of our MSc student has done. It was very useful during the corona time. That how the soap versus hand hygiene. Hand hygiene, she did it with how the soap is, how this solution, the alcohol based solution is effective with the soap. The finding was so beautiful. It is better than because many of the nurses are not washing their hand due to overload of duty. So she has given in one ward, completely given alcohol solution. It is not for the study purpose, and then and there each patient they have done it, and they have taken the blood agar media, cultivated and see. It was so fruitfully effective, the alcohol based solution. So I think we have understood something about the major steps of the research. Okay. So research is not something you can start do the research, nothing to worry about it. In a step by step systematically you do, it will come very easily. Thank you so much.